Challenges in recognizing and managing anxiety and depression in primary care. Depression and anxiety are common but often go undiagnosed in primary care. Patients with these disorders frequently present with physical symptoms, fatigue, headache, digestive issues. Uh, Prevalence in UK depression episode 20.6 of adult, mixed anxiety and depression 11.4 of adult. Treatment and trend. Antidepressants are the most prescribed treatment with over 40 million prescriptions issued in 2012 and more in the next years. Access to psychological therapy, CBT, IPT service remain limited, especially for high intensity therapy. Challenges in diagnosing depression. A significant proportion of depression goes undiagnosed. Why does this happen? Short consulting time, focus on often on physical symptoms, coexisting chronic illness, physical condition may seem more urgent, stigma and patient reluctance. Patient may fear they are wasting the doctor's time, lack of adherence to treatment guideline by some GPS, a general practitioner. Inverse care law in mental health. Quality health care is less available to those who need it most. Patient is deprived communities may struggle to access effective depression treatment. Concern about antidepressant prescribing. Debate over whether antidepressants are overprescribed, especially for mild to moderate depression. Criticism. Some believe in medicalization of unhappiness, treating normal distress as a medical condition. Alternative to medication, psychological therapy, CBT, behavioral activation, counseling. IABT, improving access to psychological therapy, has helped improve access, but coverage is still inadequate. Anxiety disorder are common but receive less attention than depression. Types of anxiety disorder. Generalized anxiety disorder, GAD, excessive worry for 6 months. Panic disorder, sudden panic attack with intense fear. PIES, phobias, extreme fear of a specific situation or object. Post-traumatic stress disorder, PTSD, trauma related anxiety. Challenge in treatment, quality and outcome framework. Guideline focus on depression, not anxiety. Medication for anxiety disorder were originally developed for depression. The advantage and the limitation of primary care management. Advantage, holistic, whole person care. GPS manage both mental and physical health. Long-term relationship with patient. GPS understand family and social background. Less stigma compared to specialist mental health service. Limitation, patient fear they are wasting the GPS time. Limit appointment time, restrict in-depth mental health discussion. Inconsistent adherence to guideline lead to variable treatment quality. What is the major reason why depression goes undiagnosed in primary care? Depression is not a serious condition. Patient only present with physical symptoms. GPS always follow depression treatment guideline. Anxiety is more common than depression. The answer is patient only present with physical symptoms. What is the most widely described treatment for depression and anxiety in primary care? Cognitive behavioral therapy, antidepressant medication, hospitalization, group therapy. Antidepressant medication. What the key criticism of antidepressant use in primary care? They don't work at all. They are overprescribed, especially for mild to moderate depression. They cure depression completely. They are only used for anxiety, not depression. The answer is they are overprescribed, especially for mild to moderate depression. What does inverse care law in mental health mean? Quality health is more available to those who need it most. Mental health services are better in rural area. Good health care is less available to those who need it the most. GPS receive equal training in mental health and physical health. The answer is good health care is less available to those who need it the most. Why are psychological therapy (CBT) not widely accessible? Most patients refuse therapy. The LABS LBT service has limited coverage and lack access to high intensity therapy. Therapy is not effective for anxiety. GPS don't believe in psychotherapy. The answer is IABT service has limited coverage and lack access to high intensity therapy. An anxiety disorder always treated with different medication than depression. False. Many anxiety medication were originally developed for depression. Patients in primary care often present with physical symptoms rather than psychological symptoms. True. All patients with depression receive psychological therapy before medication. False. Medication is often prescribed first due to limited therapy access. Anxiety and depression frequently co-occur, which can make treatment more complex. True. Many people with depression is primary care go undiagnosed. True. Michael, a 48 years old man, visit his GP complaining of chronic fatigue, difficulty sleeping, and muscle pain. He has hypertension and mild diabetes. During the consultation, he mentioned feeling overwhelmed and worrying about everything. He also stated that he has lost interest in hobbies and feel like nothing matter anymore. Let us discuss his case by replying these discussion questions based on medical symptoms. What mental health condition might he have? Why might Michael have delayed seeking help for his symptoms? What challenge might GB face in diagnosing Michael depression or anxiety? What treatment option should be considered for Michael? How could the stepped care model be applied in Michael's case? Depression. Let's back up the challenges. Depression and anxiety often go undiagnosed in primary care, partly due to short consultation and physical symptoms presentations. High antidepressant prescribing rate raise concern about the medicalization of unhappiness, and anxiety is often overlooked as primary care guidelines focus more on depression. IABT service have improved access to CBT and other therapies, but availability remain limited. Primary care is essential for mental health management, but improvement are needed in recognition, access to therapy, and guideline adherence.